From Tidal Health Group, this is Health Impressions, where we break down healthcare marketing strategies for consumer brands with industry experts. I'm your host, Bryan Cush. Eliyah, so great to have you on the podcast. Before we jump in, I'd love to, you have a ranging background. Maybe just for people that don't know you, know your firm, give us an overview, kind of where your journey is and kind of who you serve.
Oh yeah, great to be here, Brian. Thanks for the invite. So yeah, my background started, I guess, when I was about 17. Started learning some coding and building little websites for people. Um, so that's kind of how I got into consulting and into the software development world. And over the years, just the technology has advanced and went from building websites for people to building iOS apps for people. Back when the App Store launched in 2008, I started a consulting company that developed iOS apps. And then about 15 years ago, I started a consulting agency, Vitalsphere Digital, which focuses on building mobile and web apps in the healthcare space. Um, and we kind of stumbled into that market a little bit. We didn't really intend, our original name of our company was actually Stratosphere Digital, and we were just doing general app development. But one of our first big clients was in the health tech space. They were kind of a mail order pharmacy. And we got this amazing opportunity and kind of fell in love with it. So yeah, I have been building healthcare apps for probably about 15 years now through our agency, Battlesphere Digital.
No, I love that. And what I love about your background, just in a selfish way, is it's very similar to ours, just from the marketing perspective. Like, we didn't exclusively start in healthcare, but now almost equally have been there about 14 years. And there is just a magnetism that when you find partners and agencies that resonate in healthcare. And I think that's where I just want to start with is why? Why healthcare? What was it that kind of made you tip into that?
Yeah, it's a good question. I mean, I think we got lucky in a way with this first client. This client was called Dividose. They were building a pharmacy very similar to PillPack that Amazon bought. And this founder just, to his credit, trusted a group of guys in their early 20s to build this incredible piece of software. And um, we fell in love with healthcare for a number of reasons. I think the main reason and what kind of keeps us coming back to it is that we could really see the positive impact on people's lives from using the software that we were building. Prior to healthcare, we had built many other apps, but they were all in areas that I would describe as more opportunistic. The goal wasn't to kind of save people's lives and increase medication adherence or reduce the burden on healthcare workers or whatever it is often in the healthcare space. And that feeling of building something that you then get to see doctors or patients or hospital schedulers or whoever use, it's so immensely satisfying. So that's probably the biggest thing that drew us in and made us fall in love with it. And then another aspect is just that they're so behind in their tech. Like, it's very easy to have an impact. You can there's the opportunities are just kind of scattered all over the ground to improve the user experience of patients and doctors, and these people are also so overworked. Healthcare workers are really, they'll spend hours and hours doing manual tasks that they don't need to be doing. And we can come in and make a piece of software for them that really improves their lives in a considerable way and lets them focus on what they actually want to focus on and why they got into healthcare, which is providing a good service to patients and trying to keep them healthy. So I think, while we still do some projects outside of healthcare, it's probably about 80% of our business these days. And we always just jump at that opportunity. We've also had a lot of great opportunities to work for nonprofits in the healthcare space, which has been immensely satisfying. Um, And I think there's just people are trying to do good work in that space on average more than other industries that I've seen. They they're driven themselves by a passion to help people, and that really is infectious. And um, we love all of our clients. We see that they got a budget together and chose us out of all the vendors they could have chosen to execute on this project. And we want to do incredibly good work for them. And it just makes it that much easier when they themselves care deeply about the customers that this software is going to service.
What I love about that and what I think I hear kind of reflecting back to you is there's this central theme of anyone in healthcare, whether it is the healthcare workers, the supporters, agencies like ours, that they want to see the effectiveness of their work, that we want to care for people and we want to see is what we're doing improving.
Absolutely. I mean, it's just an industry where it matters so much. I mean, we're talking about people's health, we're talking about people's lives. In the case of kind of this first client that got us into the space, Dividose, they're trying to deal with the problem of medication adherence for patients who have chronic illness, and they're taking dozens and dozens of medications per day in some cases. It's very hard to do right. And PillPack was kind of the first pharmacy to figure this out, where you package these pills in these little wrappers with kind of a date and time stamp. You pair that with a mobile app where 9 a.m., here's the pack you take, rip it open, take everything inside. You can't mess it up because your phone or your watch notifies you now's the time to take it. You can mark it as taken or not taken. If you don't take it, it can notify your caregivers so they can call you. Um, and so it's just a problem in healthcare that we have effective medications in many cases for these chronic illnesses, but the medications aren't adhered to. People end up in the emergency room. It's a massive burden on the healthcare system, and on the health of these patients. So being able to design a system that more or less solved that problem for these patients and really put their minds at ease, put their caregivers' minds at ease. It was just so incredible to see and to actually see the numbers. I mean, we built a little adherence score and we could see kind of, there's studies that show approximately what adherence is for these chronic illness patients, and to see it just ramp up with this system that we built was just so incredible. And we just had this sense like, man, we're part of something good here. We're saving people's lives. We're making them feel comfortable that, their grandmother is taking their medications properly and reducing strain on the healthcare system. Um, and yeah, I can't get over that feeling. A lot of software that we build kind of in the early days too, you build it doesn't go anywhere. It's some startup. They want to build an app to do something, and it's fun to do that, but it's very hard to build a business in software. So many people have apps. They go out there and they get, 5,000 downloads on the App Store and just kind of fizzle out. And that, our team might have spent a year working on a project like that. Whereas in healthcare, the product market fit is so clear. Um, the problems are so significant. The people in the space are dealing with those problems every single day. We're not spending a year building something and then going out and being like, oh, I guess the market doesn't want this. Um, you know, Doctors are screaming about it, patients are screaming about it, pharmacies are screaming about it, and there's just not enough resources and kind of people in technology to build a lot of these things. And there's a lot of kind of momentum that from these old legacy systems that are hard to switch out of.
I think you take such a refreshing look from a technology perspective that I think healthcare so often takes technology from this kind of like, well, we built it this way and you have to work within its framework. And that's some of the proprietary and kind of walled garden type approaches. But you take such a customer first perspective, not a technology first perspective. And the door I'm opening is, and you start to walk into is like, because there's such clear cut ways to define kind of success and adherence in that, like, how do you start to think about measuring and seeing the effectiveness of the technology's use or adoption?
Yeah, I mean, there's all sorts of different metrics, and they're different for different health tech companies depending on what they're trying to do. With Dividose, it's medication adherence. With another one of our clients, um, pathways.org, they do education for parents on milestones for children. Their success is more just, are people using the app? Are they logging their tummy time? Are they, it's a free resource. So their goal is just to proliferate it as to as many people as possible to educate parents about what is typical for child milestones. So with that, we're just kind of tracking, okay, how are people using the app and how long are they using it and when are they using it and what can we do to make their experience better? For example, we realized, oh, a lot of these parents are kind of up in the middle of the night, um, trying to get an answer to a question from a reputable source. We should have a dark mode. That would make this a much better experience. So it's often the case that we're just tracking the normal things that you would track in really any app, all the events that are occurring, open this page, click this button, how much time spent on each. And we're just trying to understand what can make this better. Are they spending a lot of time on this page because it's an engaging page, or are they confused and having a frustrating experience? So we're always just thinking about the user experience. And yeah, in healthcare, technology is often getting in the way of that because you have these very old legacy systems, particularly kind of like the electronic health record systems, Cerner and Epic. Um, these are by far the most ubiquitous, and they're really hard to work with. Their APIs are kind of an afterthought. Um, and it creates a situation where one of the challenges technically in these spaces is, okay, like, how do you get data between our system that we built and the electronic health record system that maybe a doctor or provider or nurse is using? Um, and there's all sorts of silly, hacky ways to do it. Interoperability is this new thing that everyone is kind of trying to figure out, and FHIR and kind of data standard formats like HL7. But at the end of the day, a lot of these electronic health record systems or pharmacy systems like QS1, for example, they just don't expose their functionality through their APIs in most cases, or they'll expose a tiny fraction of it. So we end up, if I'm trying to think about someone listening to this who might want to get into developing healthcare software, and um, some of the some of the issues that these people are going to find as they get into it is that you end up having to come up with very creative ways to do this. So, for example, okay, we need this data. We can't get it through an API because that just doesn't exist. We try to petition the electronic health record company to add this API. They tell us it'll be, 2 years from now until they have it in their pipeline. So we come up with another way of doing it where we run an automated report every 5 minutes and download that file to a local machine in the pharmacy and have a server look at that file every 5 minutes and be kind of constantly uploading it to our server. So you just kind of get creative and come up with ways of doing things that when you look at modern software development, you don't want to be doing that. But you just have to. And these healthcare systems are getting better. And there are kind of EHRs now coming out that are kind of API first, and just kind of, they're using their own APIs to build their own software. So just kind of everything, it's like 100% coverage. And that is extremely refreshing to see. But still, just the technology that is used is behind. And a lot of it has to do with Well, there's a number of barriers, right, to get into this. I mean, the first one that we experienced back in the day when we worked for this pharmacy was sign this business associate agreement. And okay, I didn't know what that was at the time, and I read about it and sent it to a lawyer, and the lawyer was like, "Don't sign that." Um, I'm like, "Okay, well, this is like a huge project. We want to do it." The lawyer's like, "Okay, well, you still shouldn't sign it, but fine, I guess if you want the project, go ahead and sign
Great
it."
legal advice.
Um, so we signed it and we got insurance and we understood kind of what HIPAA is and how to develop software in a way that is HIPAA compliant. Um, and that was challenging. There's definitely a barrier for entry for people who are software developers to navigate that space. So I would say there's lots of opportunities, but then there are some things that are kind of obstacles in the way.
Is there high, even maybe in that moment of learning with the BAA or just over time, is there high level ways that you would frame people the difference of stepping into something that is HIPAA compliant or needs a BAA? Because from even our perspective, we bump into this from a marketer's perspective because we can come across sensitive data and it's almost laughable how ubiquitous the BAA has become. And like we've seen other agencies sign, but have no understanding what the actual implications of that means. Like from your view, is there a high level on how you would describe that?
Yeah, I mean, basically for accessing protected health information, um, really any personally identifiable information about a patient, that includes any sort of health information, you have to sign a BAA, and that creates liability for you. Now you have a responsibility to manage and protect that information according to the regulations of HIPAA. Um, and what exactly that means is a matter of debate. There's always teams of lawyers trying to figure out exactly what it means to be HIPAA compliant. It's not this binary thing where you just are or are not. But generally speaking, you have to make an effort to protect this information and be compliant. So there are third-party tools that help you do this. Secure Frame, Compliancy Group, Vanta. So we've helped organizations use those, and internally we use one as well. But basically, from a more like software development perspective, nowadays, you can just spin up a HIPAA compliant AWS server, and they're handling most of the kind of technical security requirements for you. So encryption, storing it encrypted, transmitting it, just like all the kind of access controls and logs that you need, to be compliant with HIPAA. So that aspect of it has become fairly outsourced, which is great. It didn't used to be that way. So the challenges nowadays are more centered around process, where you can't just spot a bug in the software and have the patient or the client send you a screenshot. Um, you need proper secure ways if you're going to share information, to report a bug. You either need to like black out all that information, or you need to just share it in a more secure way. So, and you need better like access controls around, okay, who is accessing this actual production database when, and when they don't need access anymore, you need to remove their access. So it's all kind of like operating procedure encumbrances nowadays for the most part. And it is annoying, but it's important. And, our strategy has always been, do we need to store this information? Like, is there a good reason to store this patient's data in our server? Or can we offload it to the maybe electronic health record system or the pharmacy system, and then just kind of have some sort of API connection pulling it in occasionally? But okay, if we do have to store the information, let's store it properly. Let's encrypt it. Let's make sure we're only accessing it when we absolutely have to. In most cases, if you're building out a new feature and you're trying to test it, you can be testing it with like a dummy patient with dummy data. You don't need to access a real patient's data at all. The times when you need to access a real patient's data is when there's a bug specific to that patient in your software and you need to investigate it and kind of see what happened. Um, so there's that mindset of kind of really thinking through clearly, do I need this? Okay, if I do need it, do I need it right now? Can I access it once? Do I need to access it over the course of a week? Who needs to access it? Um, that is really a challenge. It's not complicated, but over the course of, a 6 months or 12-month project, when you're developing some complex software, it adds a lot of time and expense that you wouldn't have if you're not building something that's HIPAA compliant.
Yeah, it makes sense. If I hear back, it's almost like you're saying the technology, infrastructure, and security has become commonplace. It becomes like a people and a process problem, which I feel like is every time you hear some kind of hack or ransomware, it's usually a people problem.
Yeah, the most common HIPAA violations are just someone not logging out of their computer or keeping a file open on their desk, things like that.
Hmm.
It's rare that people are um, you know, negligent in the kind of technical software security space these days because it's all being outsourced to these big companies like AWS and Google Cloud. They all have HIPAA compliant solutions.
Is there a project or a success stories that kind of jump out to you looking back on healthcare? Like that, even the one you gave to me, just so tangible of you had a baseline of kind of adherence modeling within the space so you could create an adherence score and not only see the effect on almost an individual level is what I heard, but really push your client's brand to go, look, we've even set ourselves above the mark as our kind of universal adherence score. Like that's so tangible to me. Is there more that kind of jump out to you from kind of success stories or projects that stand out to you?
Yeah, that one was quite successful from like providing a better solution to patients, but then also the business was very successful. I mean, we began our engagement with that client when it was just an idea. They didn't have, maybe they had one employee. And by the time we left and they kind of transitioned to an in-house team, I think they had 200 or something employees. And they ended up selling to United Health Group for just over $300 million dollars in 2020. So that was a very successful company. Um, I would say other successes, I mean, pathways.org, as I mentioned, that has been a real success. Basically, I mean, I'm a new father. I have a 1.5-year-old daughter, and I live in Iowa. So my wife gave birth at a University of Iowa hospitals and clinics. And in the folder that we got to take home with us was a little flyer for Pathways, which was cool because we were building the app at the time. And um, um, they're one of the leaders worldwide for this type of education, and it's extremely important. As a new parent, I'm very familiar with the anxiety of is this normal? Is my child kind of behind on any of their milestones, or are they doing good? Do I need to talk to my doctor about anything? Um, but all their information was presented in just like a website or these printed pieces of paper that they would give home, that they would give to um, parents when they left the hospital. And it was just very hard to find. You had to go to pathways.org. You had to click on, okay, 3 to 6 month age range. You have to find the thing that you want. So we were able to build an app that, it knows the milestones that you've completed. It knows the age of your child. It's following along with what articles you're reading and suggesting the things that you need. It suggests all sorts of games that you can play with your child. So if you're behind on a particular milestone, it'll recommend games to correct for that, and just kind of brought that information into what it should be. in today's technology world, which is something that follows along and is kind of there with you as your child grows. And that's had a lot of success. I think, I don't know, I think it's like 4.9 stars on iOS and Android with, thousands of reviews. Another one that's been just really amazing to work on, also another nonprofit, is Serum.org, SIRUM.org. They're one of the largest medication donation platforms in the United States, and um, they've distributed hundreds of millions of dollars of donated medications to low-income households. So they make it very easy for pharmacies, hospitals, healthcare companies to donate medications and get a tax write-off. And then they, process all those, put them into inventory, and then they have a nonprofit pharmacy called Good Pill that will distribute those medications for, I think it's $7 for a 90-day supply of medication, and in some cases free. Um, and they've distributed hundreds of millions of dollars of medication to these patients. So just an incredible mission. Like they're the three founders that we got to work with are just absolutely brilliant. And we built kind of a lot of their logistics software. So, how do you send out packages to people to make it really easy for them to pack all their donated medications? And then how do those get tracked to their facility? And then how do those get kind of processed and run through the machines to automate whether or not they're expired or the seals are broken and get put into inventory? And then how do they get kind of taken out of inventory and skipped out to patients? And they've been incredibly successful and have grown and expanded their team a lot since we started working with them. And it's just, again, it's this example of how you can get these clients that are doing amazing things in the world. They're really helping patients get medications that they absolutely need when that patient is being forced to choose between taking their blood pressure medication or buying groceries. And now they don't have to make that choice. And we're not throwing out, hundreds of millions of dollars of medication that could be used by patients that need it. So that was a really just incredible project to work on, and definitely one that I, you know, pedestalize as being successful. Um, yeah, I mean, there's others too that are um, have just been a lot of fun to work on. Honestly, one of the ones we've been working on recently is for this company called Invia. Um, they do kind of like nuclear imaging in hospitals. So they basically take the images that are captured by these cameras and, like a MRI scanner, for example, and they process it in this extremely unique way to give insights for the doctor on kind of things like blood flow. And so it's really taking the raw data and kind of presenting it in these images that let you get a lot more information. And again, they're on this old school system of if you want to buy their product, you have to install a server in your location, in your hospital. um, Very cumbersome process. So we have been working with them to build a web application so that their whole system is modernized. And that has been a lot of fun trying to figure out how to kind of translate a desktop app that has required this local server in on location into being in the cloud and still being able to kind of process the complexity of their images. Um, so yeah, I mean, for every success story too, like there are apps that we have worked on that have not translated into like being very successful. From our perspective as a software development agency, obviously we want to work on projects that work and that improve people's lives. Um, but we also measure success internally by just did we successfully execute on the vision of our client? Did we build the software and give the entrepreneur like a shot at going out into the market and building a business based on this? So one of the things that we do that's a little bit different from a traditional agency is we don't outsource work. Um, all of the work that we do is done in-house by our employees. All of our employees are in the United States, and we have a couple people in Canada. And we don't hire junior developers. It's very common practice to have an agency make most of its profit off of, charging high agency rates and hiring junior developers for kind of low salaries. And that spread drives a lot of the profit. And we don't do that. Every single one of our developers is a senior full stack engineer with years and years of experience. Um, and it's kind of selfish in a way, just because junior developers, there's nothing wrong with them, but they just inevitably don't have the experience to write good code and make good decisions every day. And so they inject a lot of technical debt into a code base that then we don't want to work with. We like, we like building things and solving problems and coming up with the right solution for the problem. Um, so yeah, that enables us to position ourselves as an agency that is much more elite, where our execution risk on a project is extremely low. We basically don't take on projects where we're not completely positive that we're going to be able to build this and deliver it to the client. And then also, it takes a lot of stress off my shoulders as the CEO and founder. I Running an agency is, I mean, people say it's a hard business to run. I'm sure there are much harder businesses to run, and so, and I'm not sure I completely agree with that, but I think it's made difficult by the business models that drive it, which is to try to maximize the spread on what you're paying an employee to what you're charging a client. And that incentivizes kind of low quality work in a lot of cases. And we just kind of reject that because, well, we just don't want to work on projects like that.
Hmm.
Yeah.
No, I mean, that resonates with me personally so much. And I knew we'd be ranging in the topics we talked about, but it's historical that we're even landing somewhere I didn't even expect to. But equally the same. I mean, I take the word selfish in a very positive way, that like you've clearly carved out a niche for yourself, and a niche successfully that kind of attracts complex scenarios, like that requires senior complex thought. So I'd argue the same. It's so common in the marketing agency world that it's in this kind of AI outsourced overseas VA world that it's just like this huge margin of difference between what's spoken and what's delivered. So I resonate with that on a lot of levels.
Yeah. And which isn't to say that you can't outsource work and have it be successful. I have seen outsourced teams execute successfully. I just see it fail more often than it works. I think it's hard to get right. Um, and many of the projects that we end up working on started with overseas teams where the founder tried to, cut costs and do it for half the price. And then they get to us after, a year of not getting what they want. And it's often the case that the code is so bad that we have to just start over, which is obviously devastating to everyone. So it depends on the project, and it depends on the kind of connections that you have. I wouldn't say overseas teams are always going to result in, a bad execution of a build. I just think it's injecting a lot of execution risk, and it's hard to know.
Yeah, my definition of outsource is probably even looser than people think. And I had a friend that's a very successful healthcare technologist kind of describe it to me that way. It would just be very clear in what part of the process is your uniqueness. And like the simple example I think you even gave to me, mirrored to the one he gave, is like you're not building HIPAA compliant like foundational infrastructure. Someone's already did that. You're outsourcing that to AWS. You're outsourcing that to Google Health Cloud. Like I'm not competing with them. And like the simple analogy he gave was like credit card processing. Like unless you want to be the credit card processing company and compete with them, like you'll just pick that component up off the shelf. And I think even that level of thought I would classify as a type of outsourcing. Like you have to be intelligent enough to go like, this piece is not us. Like, let's not try and step into an arena that really is not our strength.
Yeah, and with that broad definition, we do that, of course. We're not, reinventing the wheel when it comes to Stripe or health
Yeah.
record systems or even like text message systems, right? All of that, we build the core technology and then we have API integrations that connect to all of those pieces so that we're doing as little as possible to kind of build a custom solution and leveraging what exists. When I say outsourcing, or at least in this context, I'm referring more to kind of, hiring developers overseas in India or Latin America or wherever, where, again, like there are incredible developers in those places, and you can either get lucky or have connections and be able to find them. And I've seen it work very successfully. It's just often the case that founders don't really know, they're not technical. One of the things I advise prospective clients on is, ask who's actually going to be writing the code. Like, can you talk to that person or those two people? Um, at our agency, our developers are there with the client on calls. They're not hidden behind layers of project managers where the client never talks to them. And we think that's important. Um, so I think it's something that can work. But if, as you're talking about outsourcing of just leveraging existing third-party tools, that is something, everyone should be doing. No one should be rebuilding video conferencing protocols or text messaging protocols. It's like we have Twilio, it's great. We have Stripe for payment processing, it's great. We don't need to be spending our time building functionality like that.
Yeah, and I classify those outsourced though kind of under the same bucket. I mean, we've seen from the marketer's perspective that scenario go poorly, where they outsource
Mm.
not only from a geographic standpoint, but then the thinking pattern that often overlaps with that is they may then tackle and go after tools that could have just been picked up off the shelf because that's just what they're told, or they don't have the creativity to realize like we're going down a rabbit hole on something that really doesn't need to be. And we've seen that level of almost become an exponential problem because then you have a wrong people and a wrong process problem.
Yeah, no, that's a good point. And it's often the case that clients come to us and they think they need a custom piece of software, and we just direct them to an existing off-the-shelf third-party solution. Like a client just came to me last week and I directed them to this service called Spruce Health, which I think is really good. They have a decent API as well. And I was like, I think this is just what you're wanting. Like, I don't think you need to pay us to build anything custom for you. Why don't you just check this out and let me know if it falls short in any way? Maybe we can, figure out how to do some custom stuff there for you. But yeah, we want to make sure when we're talking to prospective clients and thinking about projects to work on, um, we want to understand exactly why custom software has to be involved here, and it needs to make sense for the business and the technology. Um, and yeah, sometimes it just doesn't, and the client is just not aware that there are these other third-party solutions out there because in the last decade, a lot of new health tech companies have come out with some really amazing solutions to some of these problems. And the clients that work with us tend to be fairly sophisticated in the sense that they know what's out there, um, and they know exactly why they need to build a piece of custom software. And that's what we look for in a client. We want someone to understand what they're getting into. Building custom software is a journey. It's expensive. It's not like you hand us some money, we hand you some software, and that's the end of the transaction. Like there's ongoing maintenance forever for these types of systems, and they either need to engage with us to do ongoing maintenance and support and bug fixes and building out new features, or they end up building an in-house team. And both of those are expensive, and we really want to make sure that if we engage with a client and build this product for them, that it's going to grow their business and make sense.
Yeah, you may have directly or indirectly answered my question, but I'll kind of ask it anyway. I was going to be curious that that's such a refreshing take of really almost helping the client or prospective client determine if this truly is unique? And you mentioned, I mean, is that more the case that they've done that due diligence and come to you with that pain point that they can't find off the shelf, or is that almost a level of consultancy that you're bringing to them as well?
I mean, I do bring it to them just because I'm trying to suss out what's unique about it. I'm trying to kind of download their idea from their brain into my brain and kind of place it in the context of what exists that I'm aware of, at least in the marketplace. So a lot of the times for me, it's a tool to kind of gauge how much they have thought about this or how clear their thinking is. Where, you're telling me you want a HIPAA compliant communication platform that can do scheduling and telehealth visits. And it's like, okay, well, there's a lot of those out there. Have you looked at this one? Have you looked at that one? Like, why doesn't this work? And then if they can explain to me why, this platform doesn't meet the requirements, now we can really hone in on kind of what's unique. So it's often just helpful to have those kind of benchmarks of other services in the space. Because it's also, as I mentioned, the case that sometimes they're like, oh wow, this is exactly what I wanted. Great. So there you go. No need to pay me all this money to build something that already exists.
Yeah, there's a commission check in the mail.
Yeah. So yeah, I want a long-term relationship with our clients. I care about that a lot. And I don't want a client that I'm going to work for 6 months and then we're going to end on bad terms because I didn't confront them in the beginning that I thought this product already existed or was a bad idea or just didn't make sense to me. And not that I am necessarily capable of evaluating the efficacy of their ideas, but it needs to make sense to some degree. Um, you know, a lot of these startups, they're in healthcare in particular, you're asking a doctor to use some new system. Someone's trying to build a new app. And, my question is always like, are you sure doctors are willing to do that? They're pretty busy. They're really going to pull out a new app just for your thing. I think, and then we get into the conversation of, well, maybe we build this as like an Epic app. We integrate it into the EHR. So it's not some standalone thing and you don't have that problem. So a lot of the time the ideas are good, but just the client doesn't necessarily understand what's technically possible. They just think of app and they don't think that, oh, you can actually integrate this into an EHR directly and add a lot of functionality. And now there's no barrier to its use. So I'm not just trying to help understand what it is that they're building. I'm also trying to help them or just guide them through the process of figuring out kind of what is the best technological medium for this to exist in.
Yeah, it reinforces my kind of refreshing, unique take that you bring to the problem. I think is truly the customer first perspective. If I kind of summarize all of that, is the person that's even presenting the problems, not the end user that's about to use this application. So how do we put ourselves in that person's seat? And that's what I hear from you. That's just so unique, refreshing, and ultimately leads to a joint positive outcome.
Yeah, I mean, that's another measure of success. We were talking about those earlier. Like, even if the project didn't result in this client building an extremely successful business, are they still willing to write us a really glowing testimonial? And we get testimonials from literally every single one of our clients. We present them proudly on our portfolio site. We think they're they're the real validation of our work in a lot of ways, where not all of our projects end up resulting in successful businesses, because building a business is hard, even if you have the software that you think the market wants. But that founder loved working with us, that we did right by them. We didn't just kind of take their money and not think about their business in a larger sense. We really tried to help guide them through what it means to build a piece of software and what that how that integrates with their business and just strategically how all that's going to work.
Well, I feel like I could talk to you for hours, but I'll be respectful considering we both got on talking about the perils of having toddlers. So
Yeah.
I think glowing reviews is a very high point to end the conversation. But I always like to just simply put out if people wanted to learn more about your company or even engage with you personally, kind of where are the best areas for people to reach out.
Yeah, I would just check out our site, vitalsphere.digital. Um, and yeah, I mean, you can fill out the contact form there. Our phone number's on there. You can call me, you can email me. Um, we have tons of case studies. All of our testimonials are up there. And that'll just give people a really good sense of the type of work that we've done. And yeah, looking forward to hearing from anyone that wants to chat.
Awesome. I really appreciate the time. And honestly, I resonate so much with not only the work you do, but the company you're trying to build. It sounds like a very intentional culture internally and externally.
Yeah, appreciate that. And thanks so much for having me on. It's been a pleasure.
Thanks for listening to Health Impressions. Subscribe on your favorite podcast platform so you never miss an episode. Leave a review to help us improve and connect with us on social media. Keep exploring, learning, and pushing boundaries. Tune in again soon.